All right, so welcome to the Swetland seminar. Please share your name and the organization you represent in the chat box. If you're not familiar with the Swetland Center, in the late 1950s, David Swetland and Marion Swetland felt not enough was understood about the unintended health consequences of chemical, agricultural, and industrial products in our environment. So at that time, there was little medical science that documented the relationship of diet and lifestyle to human health. So they focused the Marion Swetland Professorship of Environmental Health Sciences on preventative medicine and the effects of man-made environmental hazards so that all graduating doctors would have an interest in and understanding of the impact of the environment on human health. So today, the Swetland Center continues Marion Swetland's legacy by building partnerships to find and scale solutions to redress the environment's disparate impact on low-resource populations in Cleveland and beyond. As research continues to demonstrate the vital connection between the environment and health, the center is positioned to respond. So our mission is to study the complex interplay between environmental determinants and population health outcomes. And the center places special emphasis on community-engaged approaches that address the role of structural racism in creating and sustaining environmental health inequities. And we seek to translate these findings into policies, practices, and relationships that promote community and population health equity. So to the right of your screen here, you'll see our core focus. This triangle demonstrates our core areas of focus. So training and education, community engagement, and research. And if you're interested in learning more about the Swetland Center, you can check out our website at case.edu/Swetland. You can also email us at swetlandcenter@case.edu. I'll put all those links in the chat as well. We do have a couple of announcements. So we are still recruiting for the community nutrition team here at the Swetland Center is recruiting for the FM Engage pilot study. So we're recruiting families with SNAP benefits to participate in an app, FM Engage app pilot study at select farmers markets in Cuyahoga and Muskingum counties. And this app is designed to provide families with information to help them prepare for market day and access fresh and healthy foods at the farmers market. So if you'd like to support these efforts in recruiting participants, or if you know someone who would be interested, you can contact us. I'll add this phone number in the chat and the email, as well as the link to sign up for that. And our next Swetland seminar will be on Tuesday, October 24th at 9 a.m., virtual as well. Dr. David W. Lounsbury, faculty affiliate of the Swetland Center, and associate professor of epidemiology and population health, and associate director of patient-centered outcomes research training at the Albert Einstein College of Medicine in Bronx, New York, will present about crowdsourcing innovation for digital technology and HIV-related implementation research. Registration details for the October Swetland seminar are on our website, and I will also add that link to the chat in just a moment. And I'm excited to introduce today's speaker, Dr. Francisca García-Cobián Richter. She's a research associate professor at the Jack Joseph and Morton Mandel School of Applied Social Sciences here at Case Western Reserve University. She has a bachelor's degree in statistics from the Universidad Católica del Peru. Her MS in statistics and PhD in agricultural economics are from Oklahoma State University. Prior to coming to Case Western, she was a research economist in community development at the Federal Reserve Bank of Cleveland. And Francisca's research focuses on the analysis of social interventions and the environments in which they operate. Much of her work relies on the integration of administrative data systems and the use of causal and predictive modeling informed by qualitative contextual information. Her recent work on homelessness and evictions uses administrative data linked across several health and human service agencies within a county, along with experiential knowledge to analyze social interventions that address extreme housing instability. Francisca has led the development of a certificate program in data sciences for social impact at the Mandel School of Applied Social Sciences, in collaboration with the School of Engineering. The goal is to prepare graduates to navigate and influence this new era of technology and data-driven solutions, empowering them with ethical guidelines and a framework to address discrimination bias. She's also the director of the Math Course Super Saturdays at CREW, a community-oriented academic enrichment and mentoring program for area, middle, and high school students. So welcome, Francisca, and I'll turn it over to you to present.
Thank you, Linnea. Thank you so much, Darcy and everyone at the Swetland Center for inviting me to present this work. I'm very excited to meet all of you, even if it's virtually, and share work that we have been doing with collaboration of members of the Swetland Center. So Emily Nelson, who's I've seen in one of the little videos that we have here. She's here with me, and Darcy is part of a advisory committee that was behind all of this. But as I said, I'm going to try and share my screen, make sure that that's working. Okay, great. So can you hear me well? Yes,
Yeah.
and great. I won't be able to see a lot of the chats, but if there's a pressing question, please feel free to either say it out loud or put it in the chat, and then maybe somebody at Swetland can help me address that. Otherwise, I'll just keep sharing this work, and then we'll have some ample time for questions. But again, thank you. This is a presentation on a new framework that we've been developing, as I said, with several colleagues across the university. FAIR2, a framework for integrating community knowledge and addressing discrimination bias in social data science. I want to say that as you can see here, Emily Nelson from Swetland Center is a co-author. Nicole Curry, she was a graduate student at the Mandel School, and she's now at the Cleveland Foundation. Laura Brookman is a colleague in engineering. Shanina Knighton is in nursing, and now also at the Center for Infection Prevention and Control Research. Also, thank you, as I said, to the many people here at the university that helped us seed this project. Among them, a special thanks to Ms. Meredith Cycle, who gave us that initial stepping stone to start thinking about the importance of being more explicit in the ways in which we address discrimination bias in the use of data, for as much as big data, as we might have and we might leverage. If we are not explicit about the ways in which we address discrimination bias reflected in that data, we're not going to move too far. I think that is probably common knowledge by now. Also, the work was funded after support by Ms. Meredith Cycle by a Public Interest Technology New America Foundation grant. Right. Okay, so starting, I suppose, especially in the summer of 2020, we seem to be, I think, as a society here in the United States, turning again the clock back to a cycle of violence, of an explicit realization that we still have a lot to go to address discrimination, in particular racism in our society. This was a time also when we were seeing a number of it was a lot of news and excitement, along with fear, about the use of algorithms and big data in better uses of social data, and especially for decision making when it came to addressing needs that even the richest country in the world was still struggling to address, like safe housing, access to water, access to healthcare. So here I want to point to just a few either news or articles written that address that, an algorithm that screens for child neglect could harden racial disparities. This was PBS News in 2022. And very recently this year, a continued discussion on that algorithm designed for child welfare could have the potential for discrimination. And now the Justice Department is looking into it. In 2019, a widely used healthcare algorithm has racial bias. This was a report by Harvard School of Public Health. And as we probably, it's not surprising, police data that predictive policing programs rely on are skewed towards crimes committed by people of color. This was a report by the Human Rights Data Analysis Group in 2016. So again, at the same time, I'm at the Mandel School of Applied Social Sciences, and one of the big challenges in social work was to harness technology and data for social good. So we face a realization around that time that there's still much to do in terms of addressing discrimination, and at the same time, a need to use this new access to data technologies for social good. At the time then, I believe it was January 2021, at the Mandel School, we came to offer a class. It was a seminar. I think some of you might have taken the class. Callie, I think I see Callie there. We had read The Condemnation of Blackness by historian Khalil Gibran Muhammad that provided a very intense, deep historical account of how the social sciences in the early 1900s were developed, the use of data, the use of census data, the changes in the ways, like the way in which a variable called race was conceived, and how, unfortunately, people in academia, in statistics, economics, and some activists too in social work, in medicine, had used data and, I'd say, bad logic to create a connection, a misplaced connection between race and crime. So this book is, if some of you have come across it, have read it, it's a difficult book to read, as the author states in the preface, and yet it's important to read. At the time we were reading this, I was also reading the book of Why, which was the effort of computer scientist Judea Pearl, now in his late 80s, to put into words that were open to a more general readership the work that he had done for decades on trying to build a language for causality, a language that statisticians had not directly been able to develop. And a lot of this language was presented by ways of graphs, which made it a little bit more democratic for all, for people to engage in conversations about causal pathways and social policy, even if not everybody had an expertise in statistics. So we'll talk a little bit more about that. But reading these two books at the same time made me think that there was a way to illustrate with graphs, with causal diagrams, how data had been misused by early social scientists in the United States to link what we continue to struggle to undo, and that is a link between race and negative outcomes in our society. And at the same time, in this book, although, as I said, it was extremely painful to come across all these ways in which that time made a misuse of data. We also found many scholars that were lesser known, some others more, like Du Bois, but others lesser known, that counteracted those arguments, wrote letters to editors. They might not have been invited to the big podiums, the conferences, and yet use their logic and data to counteract those arguments. And so to me, that's where, the value was in pulling together these causal diagrams from the Book of Why to try to show how the arguments, the counter arguments presented by lesser known heroes, I think of the United States, had fought to debunk, those false and those misplaced uses of data. So I thought that was also a really important thing to bring today, now in an era where we are very excited about the potential of data technologies. And we are also charged with this big responsibility of making good use of data. So I'll just say that these two books came to form a one-credit class. It was a seminar, Social Data Analysis and Racism, then and now. And it seeded the way for a certificate in data science for social impact that we are now offering for any student that has, or professional that has completed a bachelor's degree. And that can be completed in 2 years. It's in collaboration with the School of Engineering. Students take 2 classes in engineering and 2 classes at the Mandel School. So just to get a glimpse of the words of Dr. Muhammad, he says the invisible layers of racial ideology packed into the statistics, sociological theories, and the everyday stories we continue to tell about crime in modern urban America are a legacy of the past. The choice about which narratives we attach to the data in the future, however, is ours to make. So the narratives that we attach to the data. And aligned with that, Professor Pearl, in an interview in 2019, and he has many ways of saying this, data alone are hardly a science, no matter how big they get and how skillfully they are manipulated. So again, we'll talk a little bit about how the narratives or the assumptions that we attach to the data are key in allowing us to interpret it. So as I said, I mentioned that the condemnation of Blackness gave us the ability to meet, I guess, heroes, right? Heroes for our society or for humanity, like mathematician Kelly Miller, who again worked with Du Bois to counteract a number of the arguments that were presented in conferences and papers that were published. And as we know, I.W. Wells also made good use of data to fight violence, like lynching, right? And Fannie B. Williams was a social worker that said the problem is, academics at the time called it the Negro problem. What are we going to do with this, group of people coming from the South and trying to, survive that society? So Fannie said, the problem, that is not how it should be called. Problem is, how does one navigate a society that is so aggressive, right, and so violent, and that requires a special set of skills. So, as I said, we put together some causal graphs based on the work of Judea Pearl. These are called directed acyclic graphs, and we provided that base of logic for the arguments of these scholars. What's interesting is that as I was doing this, we were discovering at the same time that today there are renowned epidemiologists like Chanel Howe, Whitney Robinson, John Jackson, and many others that were advocating for the use of causal graphs to understand and to address racial disparities in health and pointing to the value of, so in this case, it's hard to see, I wanted to point to just one of the causal graphs that they use to explain the racial disparities in COVID-19 hospitalizations, starting all the way back from the historical processes such as structural institutional racism, racist policies such as Jim Crow laws in state of residence and slavery, but also considering historical and contemporary structural institutional anti-racism policies like employment sector policies, etc. So this kind of reaffirmed the need to build as much as possible an explicit framework that specifies what assumptions we bring in when we analyze data. All right, so from the Book of Why, and this is all going to go into this FAIR2 framework, so just bear with me for a little bit. But from the Book of Why, what I also if you remember Judea Pearl saying, data is it's not a science, you need something else. So here's data. This is the inference engine, learning from data and assumptions from the Book of Why. And so I've just redrawn one of the graphs that he has, but this is basically, it's not a causal graph, it's just a representation of how we bring together assumptions and data to learn from, a social problem or any problem in general. So what the way in which he explains this is that we start with some knowledge that is synthesized into assumptions, that is put together into a model. This could be a causal diagram that has testable implications. And then we have a research question, and we see whether, based on those assumptions, the model that has come out of those assumptions, can we answer it? Can we answer the question whether, let's say, whether a food assistance program allows children to not skip school or things like that, or to attend school more consistently over the school year. At that time, then we also, build, then is when we go to build a statistical model to represent the original non-parametric model. We pull in data and we come up with an estimate. So we don't start here. We don't start with data. We don't start with a statistical estimation. We rather start with knowledge, assumptions, and follow all this path. That estimate that we obtain can go back to feed into the knowledge. So at the base of this FAIR2 framework is the fact that we ask ourselves, whose knowledge? What kind of knowledge, whose knowledge? And so this is not too different from this. What I've done is I've just been more explicit about the knowledge that feeds the entire process of using data to learn about some social problem. Write that here and be explicit about, along with the scientific historical knowledge, we want to include community knowledge, that is knowledge from peoples whose experiences are represented in the data. Because who better than people like that to tell us about the data, the metadata, and the things that we need to take into account when we analyze it, right? Especially if we want to learn about it and use it to to move forward social justice. So this knowledge is at the very beginning informing assumptions, but ultimately it definitely informs also the research questions that we ask. Unfortunately, in academia, we might go through a path of being incentivized to publish and add, more papers to our curriculum, but to what extent, especially when it comes to social problems, are we advancing knowledge to improve social welfare, right? So connecting with this community knowledge, historical knowledge, allows us to frame and to pose better research questions. And it allows us to understand as well, not just the data that we have from a statistical point of view, but the metadata. And that gets us to be more aware of biases and more systematically address those issues. Okay. So, I showed you some pictures, but I wanted to point, I'd be happy to share these slides. I wanted to list some of the papers that I have, we've used in this work to inform our FAIR2 framework. Okay, so thank you to Emily again for helping us also, among other things, helping us design this beautiful figure in which we use to explain FAIR. So verification, I don't know if you've come across that term. I had not when we had just started working on this, but our colleague Laura Brookman introduced it to us. Stands for Findable, Accessible, Interoperable, and Reusable. These are principles that were conceived in 2016 by dozens of stakeholders, thinking that as data becomes more processed through machines, machines need to be able to find the data, to access it, to link it, and reuse it as we improve the algorithms that make good uses of data. So these ethical standards of verification now have been accepted, and their use has grown mainly, I guess, in the areas of algorithmic use of data. What we pointed to is that if we are using social data to those principles, we need to add another set of principles. And so we call these FAIR2. And these stand for frame. Frame in the sense of framing the data by the historical context, by community knowledge. Articulate, we would then, if you remember, in that inference engine, we have knowledge that informs assumptions. So we summarize some of that knowledge to relevant assumptions that then go into expressing it in terms of a graphical model. This would be the articulate. We articulate a model for that. We identify explicitly bias based on, again, work done by computer scientists and economists in that sense. And then we report back to our community members. We report and seek to continue improving upon our understanding of data and social problems. So that was, as you can imagine, on purpose, trying to get another set of initials that would explain our process and add to this FAIR set of principles. The direct use of this was to inform the work that we would do, add to enrich the curriculum for the data science for social impact. But I have seen in my work, and I believe other co-authors too, that this is just a very good set of references, steps that we can take when we analyze data. Here at the Poverty Center, we've already used it for a couple of projects. We're in the process of using this framework for not just projects, but also proposals. So this framework recognizes that data do not speak for themselves, that our observational data reflect discrimination in society, and that an explicit framework to identify and address that discrimination will advance the potential of data science for social impact. So I think the best way to get a sense of what this FAIR2 framework stands for is with an example. And we're gonna, since we are, we're at a Swetland seminar, we're going to focus on an analysis of nutrition assistance programs, recertification for that. This was just one of the examples that we developed for as we wrote this paper, but as I said, currently we're using this for work around homelessness and also work around racial disparities in financial well-being for older adults. All right, so the F stands for frame, and we want to frame this problem. What is the problem with SNAP, Supplemental Nutrition Assistance Program recertification? So SNAP is among the strongest programs in the United States, social safety net. It has a counter-cyclical multiplier effect during economic downturns. It is considered by far one of the strongest social safety net programs in the United States. At this point, we use EBT cards, electronic transfer cards that are offered to applicants that meet low-income thresholds. I believe it's 200% the federal poverty line, but these vary state by state. Also, states, again, if one is not considered an elderly citizen, one needs to recertify for this program every 6 to 12 months. And at that time, you have to provide a detailed proof of income, assets in some cases, and an interview that can be by phone or in person. Well, the thing is that this recertification, if you can imagine, when one is coping with financial instability, and there's not much capacity at the SNAP offices either. People can fail to recertify even though they would still qualify for this, right? For this program. And research suggests that up to half of beneficiaries who exit SNAP within the first year were still eligible. So we asked the question, who is affected by failure to recertify, who is not able to recertify when eligible, and what can be done to reduce the rate of FR is what they're called. So to frame this with community knowledge, we designed or redesigned a tool that was already being used. These were called data chats, and they have been used in the past to more in the public health area to share statistics about health indices in a neighborhood and engage the community mainly in actionable work against those health issues. And that is, again, you know, with a potential to reduce health disparities. What we wanted to do is use these data chats in a way that we would, if you remember again that graph of the inference engine, to shape the assumptions that we use then to model the data, to shape our research questions even, and then to enrich the metadata. Okay, so these data chats were designed with that purpose, and we held some last year. We invited participants if they had needed at some point to recertify in the Supplemental Nutrition Assistance Program, and we held a couple of those meetings here at CASE. We had came together around really nice food. I mean, we all liked it. It wasn't, you know, fancy food, but it was really nice food, and we designed the process for for partnering with community members to learn from their experiences. And so, as you can see, these were not so much about, I mean, it was definitely like, when you think of a focus group, I always say this is not a focus group. It's, we're not considering our participants research subjects at all. Rather, they are collaborators. Because ultimately, when we analyze data, the assumptions come from somewhere, and sometimes it's ours. A lot of it ought to be, from the literature, but the literature, because of the way in which social sciences has evolved in our society, might be less prone to include community knowledge. So these are some of the questions that we used about the data intake experience. We wanted to make sure that we understood the data. So who entered the information you provided? Were you offered an explanation for the need to ask these questions, and so forth? We also asked people for their advice. What could help reduce SNAP failure to recertify? And we learned from their experiences that they considered that the communication was obsolete. There were long hours of waiting time on the phone, letters that came in the mail very close to the interview day. It was a stressful verification process. The information that they provided allowed us to create causal graphs, as I pointed to, in which historical processes of discrimination impacted the grouping of people into racial categories, which then impacted their sense of self, of dignity. They were stigmatized. This came out of our data chats, and that in itself made the process of applying or recertifying for SNAP much more complicated. We had a number of, let's see, I'll show you the ultimate graph that came out of that. All this was built with the voices of people in the community. So you can see channels of poverty that then lead to time scarcity that also impact recertification. The weakness of the social safety net also impacts recertification. And then to identify, so this is frame, articulate, identify. We looked at a number of patterns that could explain why the data was missing. It was definitely not random. We heard that when some participants had by accident gone to a different county, that might have less demand for the use of SNAP. They had a much better, like a nicer experience, easier. And so again, that pointed to capacity, at least, right? An issue of capacity in our county. And it could help us identify if we're missing people, if we don't see the people in the data, if we see that people were enrolled in SNAP and then did not return, it did not mean that they might not need it. It could just be that they failed to recertify, and we wouldn't see that in the data, right? So it allowed us also to look in the data for times in which people had come back to SNAP even after 3 months. 1 to 3 months is that's kind of the standard time in which failure to recertify is measured. But we thought to look for instances in which people had returned to SNAP even past 3 months. We also found that reporting back provided a really nice set of reaffirmations for the work that we were doing, but also good criticisms like this. I feel like you need to dive deeper into your research. Why are our numbers so different? And this was referring to the data intake experience that they had in this county versus others. I'm glad you're taking the time to hear our thoughts. But I feel like students using this for their research should not be the final destination. We need to show this to people in charge. I feel like the university has the people and resources that can make these changes happen. A support group where people can share their resources would be good and discuss their ideas. Maybe we could meet monthly or even 2 months to discuss what helps. And I bring this up because I know Swetland invests in providing these opportunities for people to, through their community research programs and others to do this. And so it definitely, for all of us that were involved, we felt that it was, we learned a lot from these data chats. So what I wanted to say is so this was just part of the work that we did. And as I said, we're doing more, but we, with the help of engineering, we created a website, crew-dsci.org, where you can go in and take, a more in-depth look at the framework, the 2 examples that we have, both with SNAP and then with homelessness, a guide to data chats, a number of resources, including some coding and data science resources. If we are going to use data, this provides some literacy in that area. And we want to continue to learn, and not, as one of the partners or the participants suggested, not just use this for class, but continue to inform our work in any aspects related to social welfare. So just to end, I want to say that discrimination in society is going to influence who is represented and not represented in the data, and how it has become even more clear now that even when one uses algorithms for prediction, not causal modeling, but prediction modeling, understanding the difference between the data that is being used and the population it's meant to predict, outcomes for, is really important if we want to avoid biases. One example in criminal justice is decisions for bail. When people that are released, or let's say when the release of people for through the bail process is done with discrimination in a society that discriminates, then the data that we have to use in these algorithms that are meant to enhance the performance of judges and to reduce discrimination is going to, unfortunately, just be using data that's already reflecting bias. And so it's really important to think about who is represented and not in the data, and what can be done to address that. Variables of interest also that we are using can be measured with less accuracy in the presence of discrimination. And so thinking about each one of those as part of the I in identify is important. Modeling assumptions that are not always explicitly stated in the data can be carrying bias. And so providing those assumptions, being more explicit about them in a more democratic way, using causal graphs for people with less knowledge in statistics to input, to provide input to those assumptions is really important. And so in that sense, we think that all those elements of framing, articulating a model in a causal graph, identifying, going through each of the elements that might, in the data that might bias our analysis, and then reporting back, are important to strengthen education and community engagement in data science for social impact. In that reporting back, we also wanted to let our community collaborators know that we wanted to acknowledge them in the work, and that they were the ones that would decide whether they, entered the first name with a full name. So these are our community participants for those two data chats. And you could see, you'll be able to see, if you link to the FAIR website, a list of community partners, student collaborators, faculty, and staff. I also want to just very quickly, I know I'm close to past a few minutes, Peter Hovmund, I don't know if Peter, I thought I saw Peter, but Peter does a lot of work with systems dynamics, causal loop diagrams. And that, I will say, also was reassuring to me as we took this path to say that there's ways in which we can complement both approaches. And so I just wanted to acknowledge that and thank Peter for providing that, that other approach to integrating community knowledge and causal diagrams, and helping us conceive this. So thank you.
Thank you so much, Dr. Richter. I know we do have at least one question in the chat. Someone asked for you to define metadata.
Yeah, sure. So metadata is the data of the data, and a simple way to think about it is to describe the variables in the data, to characterize, the missing patterns, maybe describe some of that. You can think also of, as you saw in our data chat, we were interested in how that data was inputted. So if it's data for homeless services, was that data gathered when the family entered homeless shelter, and were they, we want to see whether that process could have been a stressful process. Sometimes data on race is entered by the caseworker. And sometimes it's the person that provides it. And sometimes we see in administrative data that those variables change over time. So it's everything that can characterize the data. And in that, I would include the data generating process.
Garcia, I see you have your hand raised.
Hi, Francisca. Wonderful presentation. Very thoughtful presentation. So one question I have is related to, how does this play out in the real world? So one of the reasons why people seem motivated to big data and AI is because it's efficient, right? We can take all of this stuff and push a button and get an answer. So we feel pressed for time, so I teach a class in population health, and one of my favorite principles of population health that we teach is that equity and efficiency are both good goals for population health, but they often work in conflict. So when I hear what you're talking about, it sort of says it's definitely equity focused, but may not be efficient in the short term, but in the long term, yes. So how do we engage in these broader conversations? So something like this goes to what your participant said, go to the leaders of social services or whoever's administering these programs. What does that look like from being like a thought experiment to being a practice process that allows these systems to become more equitable, in their data?
Right. Well, to me, we as social scientists have moved too far away from the actual, people again that experience those processes. And I think it's good to the scientific process is fantastic and it's good to follow, but we might have been, let's say, and I'm a statistician, as I said, and an economist, but focusing too much on the statistical modeling part of things has taken us away from where those assumptions start. And at the end, those are like axioms. Like there's subjectivity in what we decide to get started with. And whether it's, very open or actually kind of hidden in the work that we're doing, and all we're focusing on is the statistical modeling part and the, p-value, but many other things. Ultimately, it's somebody's assumptions, right? And so I think that as we recognize that, we are basing our analysis on assumptions, and if we come closer to the people experiencing these processes, I think we are just by virtue of that, we are going to become more advocates for what we think is correct, for what we think moves things farther. So, yeah, and I go back to those, those images that I shared with you, people that did not give up at the very big, like they used math. It was a mathematician, it was an activist. They were all counteracting those arguments and trying to move the needle elsewhere. So I guess, if we can only follow their steps.
I just wanted to throw in a compliment really quick. I think this is awesome that you took this perspective. Judea Pearl's work was sort of the foundation of some of the stuff that I learned in my training in epidemiology. But I'm seeing it applied in a new way here. That's really important, I think, because in occupational health, we saw there was this large literature focused on how does perceived fatigue of workers predict post-shift accidents? And they went on for years, people studying it this way as this frame. But that's not really actionable. And then a group of people started studying length of shift in post-work accidents. And what you realize is that frame is actionable and it's a little more equitable. It doesn't blame the people you're studying. And you might blame the people you're studying if you never talk to them. So I just feel like that dovetails so nicely with things I learned years ago. But to see it applied in this context is really excellent. So I just wanted to thank you. It's not a question, it's just a compliment.
Thank you. Thank you. So there's another way in which we're using these causal diagrams. They unveil an issue, a bias that people have spoken less about, up until recently, and this is a collider bias. And that allows to explain seemingly paradoxes of, like, say, when we've looked at eviction data, and we see that among those that are receive an eviction filing, maybe African-American, renters are less likely than white renters to have that eviction filing go into an eviction outcome. And so people are surprised. Now we know that there are huge racial disparities in housing. What's going on here? But again, because of this collider bias, once you subset to a group that's already really impacted by housing instability, there's no way you can compare within that group to a marginalized group against a non-marginalized group, and make, make that comparison applicable to the entire population of non-housing unstable groups. So anyway, it's that would can't be explained in a minute, but it's really nice to see how these graphs help people discuss these issues without a requisite of having, built a statistical knowledge of 4 or 5 years. I see at least one of our co-authors here, Emily. Do you want to say hi? That is Emily, right?
Oh, yeah. I'm gonna pen that too.
Emily. Hi, Emily.
Hi.
I don't know if there's anything you want to share.
Oh, it was really great working on the project. So thank you so much, Francisca. And yeah, I love the FAIR2 framework. It makes a lot of sense to me for like as a counterbalance to big data. And it felt so essential when we were talking to people in the community to hear how data was affecting them and their access to social services.
Thanks. Well, I'll just say that we started, this is the second year that we're offering the intro class in the certificate program, and it's 2 classes, again, one taught at the Mandel School and another in engineering. We start in the spring, in the fall, then have a couple of more classes in the spring, and through that process, students are able to have a general understanding of the use of algorithms and causal models on a number of areas: child welfare, homelessness, services, criminal systems. And if students are interested in education, there's healthcare, a number of other areas in which algorithms are being used. They harness a set of basic tools from the engineering classes to be able to use data. We look at a number of issues related to fairness, like concepts that have been developed to analyze algorithms. As I said, the one on child welfare is currently being scrutinized. And then they have a chance of implementing a project and running it through. So learning by doing, using the FAIR2 framework and others, because this field continues to grow. And so it's not about saying this is the one and only, but rather saying how can we continue to learn and make sure that we use ultimately data for good.
Thank you so much, Dr. Richter. This is a great presentation and really exciting work that you all are doing. And that sounds like a really neat course as well for the students. So great. I know we're at time, but we will be sending out the slides to everyone who registered and attended today. And we look forward to seeing everyone next month, October 24th.
for the next seminar. So thank you, everyone. Have a great day.
Okay, thank you. Thank you, everybody. Goodbye.